Thank you for your time. I know you're busy as a professor. My name is Angela Poach, and I'm a registered professional counselor. I'm also a level 4 TEAM-CBT advanced therapist and trainer. And today I just want to take a couple minutes of your time to share with you how great TEAM-CBT is and that you could integrate this into your teaching without giving up any of the other great material that you use. So TEAM-CBT is a structure or framework on how to do therapy. It was developed by Dr. David Burns, who's one of the pioneers of CBT. If you haven't heard of David, that's a real shame because he worked with Aaron Beck and helped develop the 10 distortions. You can learn more about David at his website, feelinggood.com. He has lots of free resources for clinicians and the general public. Anyways, TEAM-CBT allows you to continue to teach and use, clinicians can use the tools that they already like and enjoy, humanistic theory, Rogerian, CBT, ACT, MDR, all these tools can fit into the framework of TEAM. What TEAM does is take research and evidence-based ideas from psychology and combines them together to create a structure or framework on how to do therapy. So it's not a new modality or school of therapy, if you will. So for instance, let's get specific. There's research on testing and how we measure outcomes with clients and patients that actually improves the efficacy of therapy. So we take something like testing and we say, okay, how can we do this well? And David has done some research on his forms, so the brief mood survey, but you could use any testing and you could teach your students as long as they were not trying to read the minds of their clients, which I think a lot of people get into psychology thinking, oh, I'm going to totally understand the brain and how it works. And I'll know why so-and-so did this to me, or like, why was my mom this way? Or we hear this all the time in the media. And as you well know, as a professor, it's not quite that clear cut, right? So, but clinicians seem to kind of still fall into that trap. And when we test, we're analyzing information that the client gives us and comparing that to how we're seeing this client in the session. So it does improve efficacy. And then we include empathy, which again, most clinicians think they're doing awesome empathy. And yet the research shows when we do testing that clients don't feel as connected to therapists as therapists perceive. And without that connection, it's really hard for a client to buy in to a direction that the therapist may see as helpful for that client. So that connection is super important. It also helps instill hope, which research has shown to be a very important part of therapy and working with clients. Then we combine it with assessments of resistance. David used to call this agenda setting. If you've seen any of his older podcasts, which if you're watching this, you probably not. But and agenda setting or assessment of resistance helps us to unpack the unconscious resistance to change. I mean, this is kind of an old Freudian concept, but taken with some new approach and really looking into. We talk about the stages of change, we teach that, but how do you affect that? How do you help a client to see what's going on for themselves and validate that? So a lot of times there's good reasons clients are doing what they're doing. Now that might still be destructive, obviously being addicted to heroin is destructive, but a client isn't doing it because they're a bad person. They're doing it because it's filling some kind of need, or it's covering up something that's been too hard for them to deal with. And so when we can honor that with our clients and patients, it goes a long way into melting that resistance. And so they're ready to move forward. And the last aspect of TEAM-CBT, TEAM, is methods. And this is where I was saying before, you can include any modality, any method that you feel is effective, you've seen in your research, whatever you are currently teaching. You can pull that in and pull the tools that are working. And our idea in TEAM is that we want to fail as fast as we can. We don't really know what's going to work exactly for any one client. We've got maybe a ballpark idea. If it's anxiety, we're probably going to need some exposure tools, we're going to need some cognitive tools, but we don't know exactly which one of those are going to work. Maybe with PTSD, prolonged exposure is going to work. That has a really good efficacy, but it may not. So what we do in TEAM is we list out a bunch of methods. We use what's called the recovery circle, or clinicians may just create a list. And we kind of work through those with the client to find the ones that work. And then we record those for the client and share them with the client. So the client is always involved in the whole process, and they're able to create tools for themselves and make lasting change. We want to dig deep and give them core competent skills so that they can have mental health into the future even after seeing us. So if I've piqued your interest, I encourage you to watch my 30-minute video that unpacks TEAM-CBT, and definitely check out David's website, feelinggood.com. Lots of free stuff on there. He has podcasts. And then also we have Talking TEAM-CBT. It's a YouTube channel if you want to hear clinicians' experience with TEAM, how it's changed their practice, how it's changed their lives. Myself and Daniel Herman, we've been interviewing various therapists, and actually doctors, therapists, rabbis, life coaches who are using TEAM-CBT to make a more effective approach for their clients. So thank you for your time. I appreciate it.